More than 20 million Americans identify as Asian, Native Hawaiian, or Pacific Islander. That's about 6% of the U.S. population. But mental health experts say Asian Americans are the least likely racial group to get help for mental health problems. The Fox Medical Team's Beth Galvin explains why.
This is a complicated issue, and Asian Americans represent a very diverse group. But one counselor is concerned that because of language and cultural barriers, some young Asian Americans may not be getting the mental health help that they need. When 39-year-old Samuel Kim found licensed professional counselor Sue Kim at the Center for Pan-Asian Community Services in Peachtree Corners after decades of struggling with depression, he says it felt like a breakthrough.
She's willing to listen to you, every word. That's something that I was not able to find anywhere else.
Because Sue Kim is fluent in Korean, which allowed Samuel, who emigrated to the U.S. from Korea with his parents when he was 13, to feel heard in a way he says he had not felt heard before.
She helped me dealing with a lot of things, mainly by trying to listen to what I was trying to say. Because I'm a very reserved person. I don't really speak much. I've been like that since I came to America for some reason.
Still, Sue Kim worries that many young Asian Americans who are struggling with depression, anxiety, or other mental health disorders are not getting help because of language or cultural barriers or the stigma, she says, that often surrounds mental health disorders in the Asian American community.
They stay home, they never go out, they never get treatment because family, they don't know what to do. And
Kim says some Asian parents may be reluctant to admit that their teenager or young adult is struggling and needs help.
They feel like ashamed to have somebody in their family members, somebody who has mental health or especially substance abuse issues. They want to hide them.
But this newer patient who asked that we not show her face says her mom, who was born in Korea, is the one who helped her find help for her depression.
I've been dealing with this, and I've been struggling, being just by myself, trying to work and survive. I barely had time to find help, and when I did try to find help, it was kind of like shooting in the dark.
And talking to a professional, she says, is helping her find her way forward.
I'm doing things a lot different, so it takes a lot of stress off my plate, for one, and I have someone there to help me.
And Sue Kim says another challenge is there's a shortage of mental health providers in the U.S. and especially right here in Georgia. So it can be hard for Asian Americans to find a psychiatrist or a counselor who also speaks their language. For your Fox Medical Team, I'm Beth Galvin.